Hello, everyone. So today we are going to be talking about the body, and today specifically, mostly in like a medical sense. Think about the last time you gave somebody directions. You probably used terms like left or right, or it's behind the coffee shop. Well, in medicine, we also use directions, and they're super important for instances like surgeries. Um, so the universal map, we'll call it, is what we call anatomical position. And once we have our map, of course, we need our land, which can be our skeletal system. And then finally, we need to understand our directions, or since we're making map references, we'll call it our compass. Our map consists of three planes. So first we have our transverse plane, which it's horizontal, cuts the body in half, like from versus top and bottom. We have our sagittal plane, which is vertical, cuts the body in half from left to right. And then we have the frontal plane, which cuts the body vertically from front or anterior to back, posterior. Um, then our anatomical position is like this, hands to the side with our palms facing forward. Uh, so normal standing, but the palms are facing forward. And then as far as like a perspective, left versus right, everything will be identified in the terms of the patient. So like if you're doing surgery on a patient, um, let's say on their right leg, it will look to you like it's on the left, but it will be identified as the right. So it kind of gets confusing, but if you just think it as like as you looking at it inversely. Um, so then we also have our terms, our compass. Um, okay, so to review our terms, um, or our compass, like earlier, we were talking about the frontal plane that cuts the body from front versus back. I use the terms anterior and posterior. So anterior means being front, anterior meaning being front, and then post, which means back, referring to the back. We also have superior, meaning up, like from the waist. Here, and if you're going down towards the pelvic, you would use the term inferior. Now, our extremities have a different term. So as we move up, like closer to the shoulder, on my arm, you would use the word proximal. And if you were going down towards my fingertips, you are going to use the word distal. And then there is medial, which comes towards the middle, middle. So medial comes towards the middle. And then there is lateral, which goes out towards the sides or the exterior of the body. So those are our terms that we use for the medical instances. And then next we are going to get into the skeleton. I'm going to talk about the skeletal system. And while I'm discussing the skeletal system, I will use some of the terms to reinforce. But yeah, so there are 206 bones in the body. I'm not going to review all of them, but I'll get some of the major main bones. We'll review those. I have my skeleton here. Um, he is unfortunately not anatomically correct because his palms are not facing forward. But he will do. Um, so I'll go over some of the skeletal bones. So like our jaw is the mandible is our jaw here. The maxilla is the top part. And then some portions of the skull. This top portion I kind of colored lines here. So this is the frontal bone of the skull. The sides, like your temple. So you can always remember like the temple. So this is the temporal bone. And then the occipital bone is back here. And then this big chunk is the proximal bone. So those are just some of the few major bone structures of the skull. And then see, we have our clavicle. This isn't exactly right. Like this isn't actually here in a real human. It's just this. But that's of course your bone here. This is called your clavicle. And then this right here that connects your ribs at the top part is called your sternum. And then let's see if we move on to the back here. Let's focus on the spinal cord, because there are a few different sections in it. So the top we have the cervical cavity. It's labeled C1 through C7 because there are 7 different vertebrae in this part. From here to where, like the last end of where your ribs connect, is called the thoracic cavity, and it contains vertebrae T1 through T12. So there are 12 vertebrae in the thoracic cavity. And then we have the lumbar cavity, which is, of course, later, starts with L1 and it goes to L5 because there are 5 vertebrae there. And then we have the sacrum. It's actually separated into 2 different vertebrae. Can't really make it out on my model, but there's S1 and there's S2. And then I also don't quite have another bone here. Our tailbone, or it's actually called our coccyx, also extends down below the sacrum. Okay, and then I'll just go right back up to, I'll go superior. There's some of our terms. Superior from the pelvic back up, inferior to the skull. We have our scapula. This also kind of looks funny on this, but this is ultimately your shoulder blade. So that's your scapula. And then I guess we can move on to our arms. This is the humerus here. It would be lateral to the ribs. And then down further, we have the ulna, which is the bigger end, and it would be medial versus the radius. So it is more medial than the radius. So the radius is the smaller bone and it is more lateral. I try to have good words to help people remember like the bones, but this one I haven't really figured a good one. I did think like are you humorous? Are you humorous? To at least put them all together in the R. So if that helps you, then great. Like R for radius and U for ulna, and then of course the humerus. So are you humorous? And then way maybe you can at least identify that those go with the arm. And then we'll go down into our hands. So we have tiny little bones like in the front part of our palm, I guess, like the upper part of our palm. And that is going to be our carpals. And then the actual like wide part of your palm, like through here, are the metacarpals. And then from your knuckles down are your phalanges. And the foot structure is very similar, and I'll get to that once we make our way down. Um, so then, I guess since we are moving inferior, next would be the coxal, which is your pelvic bone. And that is pretty much this whole bone right here. Like this whole structure, even this part, would be the coxal. And then we have the femur, which is the largest bone in the body. And that is inferior to the ribs, but it is superior to your feet. Okay. And let's see. Then we have our tibia. This one I try to make people like, to me, it kind of looks like a T, so T for tibia. And then we have the fibula. And the fibula is lateral to the tibia. And then our feet. So our feet, instead of carpals and metacarpals, these are tarsals. So just like our hands, we have these tiny little bones that are called our tarsals. And then like the top of your feet would be the metatarsals. And then of course your toes are your phalanges still. Um, so just to reinforce some of our directional terms, let me get him all figured out here. I got him all crooked. Sorry, I'm missing a foot. He's lost a foot. But so our sternum is anterior versus our spinal cord, or maybe our thoracic cavity, which is posterior. So anterior is front, posterior is back. The radius is distal to the humerus, but the radius is proximal to the phalanges. The skull, of course, is the most superior, where our metatarsals are the most, well, I guess the metatarsals would be, I guess you could use the inferior, but mostly we usually keep like the extremities separate. So I guess the pelvic would be the most inferior, but the foot phalanges would be the most distal. And our humerus would be the most proximal. Our lumbar cavity, which is here, is very medial because it's in the middle of the body. And our ulna, our radius, our radius is very lateral. So there are just a few things. Pretty simple to remember if you especially if you're using the terms often. Things are easy to remember, but just remember like tibia, T for tibia. The fibula sounds similar to tibia, so you can relate those together. The femur, of course, is the largest bone. And then coxal, most people refer to this as the pelvic. Coxal is the correct medical term. And then, like I said, RU humerus. So you can put those bones together for the arm, the radius, the ulna, and the humerus. Just remember that the ulna is the bigger bone and it's medial. It's more medial than the radius. Our sternum is very medial because it's in the middle. but it is also anterior because it's in the front. Um, the clavicle is this bone that connects here. Like I said, this part isn't actually here in a real skeleton. I just don't have a very good model. Ooh, the occipital lobe is very posterior because it is on the back side of the body. And of course, we have the shoulder blade, or the scapula is the correct term. So yeah, I think I've done some good reinforcing here. And just remember superior versus inferior for like the main parts of the body, and then proximal versus distal for the extremities. And then we have medial versus lateral. And then also our planes. So we have the frontal plane that would cut this guy in half from anterior versus posterior. We have the transverse plane, which would cut him horizontally from superior to inferior. And then we have the sagittal plane, which is also transverse, that would cut him from left to right. And there's different terms for that. So like there's mid-sagittal, which is directly in the middle, but the sagittal planes aren't always directly in the middle. Like you could cut the brain, for instance, here, and this is still sagittal, but it's not mid-sagittal because it's not directly in the middle, which would be here. Um, but yeah, so that's my review on the skeletal system and anatomical position and their terms.